Let's look at seeking treatment at an urgent care center versus an emergency room. We will explore a few reasons why you may want to visit an urgent care center rather than an emergency room facility. Remember, for life-threatening injuries, it is best to seek treatment immediately at an emergency room. One advantage of seeking treatment as an urgent care facility is cost. Typically, urgent care centers have lower co-pays and out-of-pocket costs compared to emergency rooms. For non-life-threatening conditions, urgent care centers are generally more affordable. Emergency room visits tend to be more expensive due to the higher level of medical care and infrastructure. An emergency room is designed to handle critical, life-threatening situations, and this premium service often comes with higher costs. Another advantage in seeking treatment at an urgent care center is faster service for non-emergency issues. Wait times at urgent care centers are generally shorter, especially for non-life-threatening issues like mild injuries, minor infections, or flu-like symptoms. Patients can typically expect to be seen more quickly at an urgent care facility. Emergency rooms prioritize patients based on the severity of their conditions. They function in a triage system, attending to the most severe cases first. Therefore, if you are visiting for a non-emergency issue, the wait time can be significantly longer at an emergency room due to the prioritization of critical cases. Next, let's consider hours of operation. Many urgent care centers are now open evenings and weekends, and some are even open 24 hours a day and 7 days a week. This offers a level of convenience outside typical office hours for people with busy schedules. While emergency rooms are open 24 hours a day and 7 days a week, they are intended for severe and urgent situations. For non-critical issues, patients typically experience longer wait times. Typically, neither urgent care centers nor emergency room facilities require an appointment. Most urgent care centers operate on a walk-in basis, so patients do not need an appointment to be seen. This flexibility is ideal for sudden illnesses or injuries. While emergency rooms also accept walk-ins, they prioritize based on urgency, so non-emergency patients typically must wait longer. Another aspect to consider is the environment of each facility. Many patients experience a more relaxed and less overwhelming environment at an urgent care center. Since these facilities cater to less severe health conditions, the environment tends to be calmer, which can reduce patient anxiety. The nature of an emergency room is that healthcare providers are dealing with severe medical issues, including life-threatening emergencies. The stress and chaos of an emergency room may add to the discomfort of a patient seeking care for non-urgent issues. Something else to give consideration to is the level of care needed for a less severe medical issue. Urgent care centers specialize in minor health issues. They are equipped to manage a wide range of common conditions, such as infections, sprains, minor fractures, rashes, and utilize diagnostic tests like X-rays and lab work. In contrast, the emergency room is designed to treat more serious conditions, including trauma, heart attacks, strokes, severe infections, and other life-threatening situations. These conditions require much more extensive resources, including technology, time, and specialized knowledge. Following along the prior point, We also see a more streamlined and targeted approach for treatment for minor health conditions at an urgent care center. Patients visiting urgent care centers typically receive more focused care tailored to their needs. For example, someone with a mild infection will receive medication and advice on care and follow up in a timely manner. Treatment in the emergency room is often broad, as the priority is often stabilizing life-threatening conditions. Non-critical issues might not receive the same level of focused care due to the nature of the emergency room environment. When we look at access to each type of facility, we often find that urgent care centers are more accessible in suburban and rural areas. They may even serve as a primary healthcare provider when the nearest hospital is far away. While emergency rooms are often located at larger hospitals and can be inconvenient for people living far from those facilities. Some urgent care centers offer additional services, such as occupational health screenings, physical exams, vaccinations, and travel medicine, which may be helpful in managing general health outside of emergency situations. Emergency rooms focus on acute care and trauma, so they may not provide the same preventive or routine care options that an urgent care center offers. Because urgent care centers focus on non-critical cases, they are generally less crowded than emergency rooms, resulting in a smoother and more efficient experience for patients seeking prompt care. Emergency rooms frequently face high patient volumes, particularly during peak times or emergencies, which can result in long wait times and reduced personalized care for those with less urgent health concerns. In conclusion, for non-life-threatening conditions, urgent care offers a convenient, affordable, and efficient alternative to the emergency room. While emergency rooms play a vital role in managing serious medical emergencies, choosing urgent care for routine or less urgent health concerns provides substantial benefits in terms of cost, convenience, and wait times, ultimately enhancing the experience for patients and easing the strain on the healthcare system. Thank you for your time. We hope that this information has helped to provide you with a bit of knowledge to determine when it may be advantageous to seek treatment from an urgent care facility. If you have questions or would like more information, please reach out to your HR team or Todd Klinger at Integrity Services and Solutions.